Welcome, welcome, welcome to Health Issues. I'm your host, Sylvain, and I am thoroughly excited today about this show for a whole bunch of reasons, but it is good. Believe me, sit back and relax. We have Miss Keelia O'Malley, and she is the lead author of an awesome study dealing with the feasibility of increasing access to healthy foods in neighborhood corner stores. What it's about is putting fruits and vegetables right deep down into the neighborhood, and she did a study on it. Welcome, Miss O'Malley.
Thank you. Thanks for having me here.
Well,
Excited
it's
to be here.
a pleasure. You know, everybody knows how much I'm excited about nutrition and food and neighborhood, so this kind of brings everything together for me. The minute I saw the press release on the study, I quickly said, hey, we need to get this group on the show, and we're excited to have you. Tell us a little bit about this study. I mean, what's it about?
Yeah, so the study really came out of the focus of our research center. So I work for the Prevention Research Center. We're housed in the School of Public Health at Tulane. We're part of a network of research centers around the country. There are 37 of us, and we're each located in a school of public health or a school of medicine. And each of our centers has a different health focus dependent on the community that we are located in. So our research center is focused on obesity and obesity prevention. And we do that through research. We do that through working with policymakers. We do that through community engagement efforts, and also offering training opportunities for students and community members and health professionals. So our research over the years has been looking at the food environments and the location of different types of food stores around the city and different neighborhoods. And that research over the years has shown that there's a disparity in access, that the different types of stores are located in different neighborhoods across the city. So not everyone in the city has equal access to full-service grocery stores, and that a lot of the neighborhoods that don't have close access to a full-service grocery store might have a large number of small corner stores located in them. So this came out of a theory that perhaps we could work within those neighborhoods that don't have access to a full-service grocery store to work with the small corner stores in those neighborhoods to be able to perhaps provide more healthy options for the people who reside in those neighborhoods. We know that it can be challenging for people sometimes for a variety of reasons, whether it be personal preference for different types of foods, whether it be transportation issues, economic issues to get to a full-service grocery store, and that cost is a big factor too. So again, the idea was to think about, would it be possible to work with these small stores that are so prevalent in a lot of the neighborhoods that don't have a full-service grocery store located in them, to be able to offer healthier options for people who live in that neighborhood?
Good stuff. Now, you guys are a research center, and you research obesity. So your big focus is researching obesity.
Yeah, so
right here in New Orleans.
We are.
The most obese city in Antarctica in the world.
It is an issue here. I think the last numbers are that 2 out of every 3 people located in the greater New Orleans area are either considered overweight or obese. And we're not unique. That's an issue around the country. And there are lots of ideas and research and programs trying to figure out, how do we change this? And it's not simple. It sounds simple because you just say, okay, be more physically active or eat your fruits and vegetables, and it sounds like an easy solution. And unfortunately, I think we've found over the last 30 years or so that it's not so easy, and that it's complex, and there are a lot of different factors that go into the choice to be physically active, and how to incorporate that into your daily life, and what you choose to eat and how you make that choice. So our research center specifically looks at the environments that we live in, whether that be our social environment, so our social environment, or the physical environments, whether that be in our neighborhood, whether that be in the schools that our kids go to, and looking at ways that we can change those environments to make them promote and help people make healthier choices more often, and make that choice easier through different ways. So we don't know what the answer is right now, and that's why we continue to do different research projects, trying to figure out what works and what doesn't work, and how to apply that across the city and maybe even other cities. If we can show and find something that does work here, maybe other cities would be able to try something similar and see if that works in their area as well.
Can I ask a dumb question? It's my first dumb question. Why do you guys want to do it in the first place? Why? I'm just...
Why do we want to do research, or?
Well, I mean, why do you want to just get involved in helping people become not obese? What's the motivation?
Well, I'm sure you know, as well as a lot of people, that obesity is related to a lot of other health issues, and we also know that there are disparities in the different groups of people who tend to be more at risk, and we try to focus specifically on working within the community in New Orleans and working with our community partners, and that has been it's identified as a health issue here, and we've heard that people want to be more physically active, people want to eat healthier foods, but that there are a lot of challenges to do that. So we're working to try to figure out how we can best address those challenges here in New Orleans. And one of the big challenges that we hear over and over again is we don't have access to a grocery store in our neighborhood. If we had a grocery store in our neighborhood, it would be easier. We could get to the store more often. We wouldn't have to travel so far to get to the store. So again, that was where this particular study came out of, is, well, it takes years perhaps to bring a grocery store into a neighborhood that doesn't have one right now, and it's a lot of money involved in getting that to happen. So our thought was that, again, maybe we could look at what are assets in the community right now, and maybe these small stores could be part of that solution.
Sounds good to me. Well, the reason I asked why was because if the end goal is for them to be healthier, okay, that's good. All right, and not questioning the research, but if the end goal is to do research, then that's a whole different motive and a different agenda. You see what I'm saying? And not a problem at the end, because well, that brings to question, and we must ask: has anybody figured out whether putting fresh fruits in these stores will actually lead them to be healthier?
So there has been some research around the country that's been done in other cities where they have shown that in small stores where they have a larger variety of fresh foods that are available, whether that be fresh fruits and vegetables or other healthier prepared foods, if they have an increased variety of those foods, if they are able to do marketing and promotions for those foods, some studies around the country have been able to show that the customers of those stores have purchased more of those healthier options, and that they've consumed more of those healthier food options too. So around the country in a few cities this has been shown. We have not done that particular research here in New Orleans yet. We wanted to see if it would be feasible to try to attempt that here, which is why we did this study in the first place, to talk to residents in the neighborhoods, to talk to the store owners and operators in the neighborhoods, to talk to the produce wholesalers too, to see from the supply side if they can meet the needs of those small store owners who would be interested in perhaps selling healthier food options. And our research, we talked to a lot of people and got a lot of information. And a lot of what we found was that a lot of the residents in the neighborhood, so we talked to both residents in the neighborhood through household surveys, and we also talked to corner store customers, so customers who had left the corner store, and asked them a few questions there. So the residents in the neighborhood said that they do most of their grocery shopping at a full-service grocery store, and these were neighborhoods that did not have a full-service grocery store located within their neighborhood. So these people are traveling a couple miles at least to get to a grocery store, but everybody, for the most part, the majority of the respondents said that they were doing most of their grocery shopping at a full-service store. The store owners and operators said that there were a lot of barriers for them to be able to supply and offer more produce options in their stores.
Like what?
They said that they don't have the coolers, they don't have space, that it would take decreasing space that they have dedicated to snack food items or prepared food or beverages that are common things that the customers of those stores want and that they buy.
40-ounce beers.
A lot of them do have
lottery tickets and cigarettes.
Yes, our big sales. Those are big selling items for the store owners, and they generate a lot of money.
Right.
So that's definitely a barrier in trying to see
sell
if the stores
apples and oranges as opposed to lottery tickets and beer and 40-ounce and sell them in packages. You know, I'm getting at those. So there are some studies that show that increasing availability, but it has not yet been proven, though. I mean, there are other studies that are saying that there's not really a great effect on dumping a few fruits and vegetables around.
Well, so there have been some recent work that has sort of challenged some of the traditional thinking and the theories behind food access. So there's a large body of work that has been done where there have been associations made, so not causal associations. We can't say with the research that has been done the direction, but where we have seen that access or better access to grocery stores and better access to fruits and vegetables particularly have been associated with healthier weight status, with increased consumption of fruits and vegetables. And there is a large body of literature that does make that association.
Right.
There have been a few studies that have come out in the last year or so that look over time, and they're looking at where these stores are located over time and increases in access to those stores, and looking at health, behavior, and weight outcomes. And they have not been able to show a significant association. There are some challenges with those studies. They're largely based on big state level or national level data sets that don't always get down to the real specifics. They might have some missing information. The store information may not always be as accurate as a lot of the research that we're able to do in New Orleans, because we're able to do on-the-ground research. We have a large team of both public health students, and in the past we've also been able to employ community members to be trained to work on our research team. You guys have like an army when y'all go out. I've seen you. Y'all go like about 75 people with little ink pens. We have, but the benefit of that is that we are able to do this real in-depth research and have really accurate information about where stores are located in New Orleans and what foods are located in those stores.
High crime neighborhoods. Right?
Some of them are, yes.
Right, because that's the neighborhoods we're looking at. So, but I guess to bring it around, you guys are looking at whether bringing in more fresh fruits and vegetables will affect people's dietary habits or appetite. But there's, research-wise, if we're going purely on the data, it's still kind of a hope for right now that it might be important. Yeah,
so we just are looking at this one piece. There are a lot of different theories and models of thinking about why people, how to change health behavior.
How to change appetite.
Exactly. And there's a lot that goes into that. Diet is very complex, and what we choose to eat is really complex. So it's influenced by our individual preference for the different types of foods that we want to eat. It's influenced by what we were exposed to growing up. What kind of foods did mom or grandma make for us? What our skill level and comfort level is with food preparation. And then another piece is what's available to us, what's convenient for us. So that's sort of the piece that our research center is focused on for the most part, is looking at what people have access to, and if changing what people have access to can help to make it easier for people to make healthier choices when it comes to what they eat.
Yeah, now, so what we're at then is that, you know, we like to look at what's available, but the bigger question seems to be, and kind of embedded in it, is that what makes some people eat hot sausage and others eat broccoli?
Yeah, and again, I think it's a complex question, and it's a complex issue and a complex behavior that, particularly for adults, has been built up over their lifetime of what we have been exposed to and what our personal preference is. There's a lot of interesting and innovative programs now going on with a lot of the kids around the city, and even in some of the schools in New Orleans, where there are young children who are going through school and they're getting more nutrition education, they're getting hands-on learning experience about growing their own food and cooking lessons with their families, that may be able to change their food preferences. So maybe kids who are exposed to these lots of varieties of different fruits and vegetables and learn all about them, and they're interesting and fun to them, then maybe with that exposure, their preference may be to go for that apple or banana,
as opposed to the candy bar.
Yeah.
Now, question though.
Mm-hmm.
Okay. I think it's exciting. I think nobody never knew that there's this Obesity Research Center right here in New Orleans,
mm-hmm.
in the Tulane School of Public Health.
Mm-hmm.
And you guys are going out there asking those questions. Why are these questions so difficult to answer?
So a lot of what is so difficult is that, again, back to the issue of obesity and how it comes about. And at the most closest point, we know that obesity is caused by not expending enough calories and consuming too much. So that's simplified, right?
Okay,
but what are the reasons why there are some people where this is a lot harder for than others, or whether it be individual, whether it be the families or the communities that we live in? There are a lot of things that go into that, and there's some research that's looking at not just how to get people more physically active or how to get people to eat healthier foods, but looking at what are really the root causes of this. And a lot of that, it's called social determinants, and the social determinants of health, and looking at what are those root causes and those characteristics or factors that are associated with putting people at higher risk of not getting enough physical activity or smoking or not making healthier food choices. So really looking at those root problems, because I think a lot of us know there are tons of educational programs, there are tons of training programs out there, and they're not all making as big of a difference as you might think that they would. So there is a line of research now, and we have a lot of researchers in the School of Public Health who are looking at these social determinants of health.
Yeah, because everybody knows what healthy food is. I mean, it's education. I'm sure it can get a little deeper, but but are we looking at, when we speak about the social determinants of health, when we have the educators here, it's almost the exact same question. How do we get little Johnny and little Missy to study as opposed to watching TV? How do we get little Johnny and little Missy to eat broccoli and spinach as opposed to ice cream and Coca-Cola and some other type of poison?
Yeah, and that is sort of the benefit of looking at the social determinants, because there are so many factors that are interrelated and that have, so education is a factor, your economic status, your job opportunities, they all sort of are all related to either positive health outcomes or negative health outcomes. So if we can figure out a way to really address these root causes, then we're not just addressing obesity, we're not just addressing diabetes, we're really addressing healthier and happier lives for everybody.
And I have to ask this question. We didn't talk about it earlier. Okay. Because obviously you're dealing with two different schools of thought, and probably more than one, but we can kind of break it down. One group saying individual responsibility.
Yes.
They need to get themselves together, whop them in the head, and get it together. They need to quit eating all that garbage and and go to school and study. And if they don't want to do it, why care? I mean, let them do what they want to do. The other group is saying that, wait a minute, they're not really all entirely responsible, that their environment has something to do with it, and we should work at trying to change their environment. I know you, as a researcher, you're doing a great job, awesome. Does your own personal philosophy or the philosophy of the institution affect how we approach those two questions?
Yeah, so I think that based on a lot of the research that we've done and looked at over the years, there might not just be one answer, and it might not just be changing the environment, and it might not just be educating one individual and having one individual who can make those harder choices that are better for their health. It might take both changing the environment to make it easier to make healthier choices, and having more education out there, and having really willing individuals who are sort of leading the charge and making healthier choices, and maybe influencing their social networks and the people that they're around, and encouraging those healthier behaviors too. So again, we're playing a small role in the research that we do, because we do want the research to be good quality research. So we really focus on one specific question and try to limit the scope of what we look at, so we can say something really really valid about the research that we are doing. So for that reason, we have really focused in on just looking at the environment and trying to figure out how, or if there are changes made to that environment, if there is a change in behavior, and if we can find cost-effective ways to make improvements in the environment, then there may be more of a population effect, a larger effect for larger numbers of people than an education program or individual sessions would be able to have on just one or a handful of people.
I think it's awesome, because by asking the questions and doing the research, because the flip side to that is, if what we do know, if we can help these kids nutritionally reduce obesity, obesity is now looked at as a disease, as if it's new information.
Right.
That's like, that was cute. Like, yeah, right. Okay, now obesity is a disease. More people are dying because and I don't know anybody that should lose weight that doesn't want to lose weight. I think that we can agree upon, that everybody that wants to lose, that's obese, would rather lose the pound. So it's not as if they don't want to, it's just that jumping over that hurdle to be able to do it. So I don't think you have unwilling participants.
Right, and again, sort of our perspective on that and the research that we have been involved with in the past is trying to find ways to make our environments and the places that we live, the places where we work, where our kids go to school, to incorporate and promote healthier behaviors in all of those settings, and make that more common, make it the norm, make it easier to incorporate into our daily lives. So for people who are really willing, it's easy for them to make those healthy choices. And maybe people who aren't totally on board with making those healthy choices yet, if they see other people who are making those healthy choices, and if they're in an environment where those choices are easy to make, where they're promoted, then that might make it easier for them to start making those healthy choices. Okay,
sounds good. Now, let's go to this. Define healthy choices. We're kind of speaking about it in general, but you had to make an assumption in your study as far as what's healthy and what's not healthy. Help me understand.
Yeah, so in the corner store study, we were really just looking at fruits and vegetables. That's a pretty undisputed
so
healthy
you didn't
food
get into
item.
The tough stuff.
We did not. There are a lot of issues with processed foods and prepared foods that we did not get into. There are some researchers around the country who are working in corner stores to improve the nutritional quality of the prepared foods that are being offered in those stores, because they found, along with our research, also found that a lot of the customers at the stores are buying beverages or prepared foods. And again, that sort of goes back to, it's a convenience factor maybe, that it's something quick and easy for people to buy and to eat with little preparation time. So one thought of a way to help make healthier options available in other areas of the country, they've looked at changing or adding healthier options, or changing decreasing the salt or the fat content and sugar content in some of their prepared food items.
So if you eliminate or decrease the sugar, fat, salt, and grease, people will buy it.
I didn't say that.
That's good. That was a trick question, know.
Yeah.
Yeah, well, because, okay, fruits and vegetables, I mean, that's an easy point. The thing that we lead to, though, is that there are people, people that know what's healthy, they have a get general idea to the extreme side, but marketers do a great job of hiding unhealthy foods and calling them healthy, whether it be bread. I mean, really, I mean, you go through the whole, go in some grocery stores, all grocery stores, and you look at the foods they call healthy. But I was saying, by whose standards? They're all death knell foods, you know, it's going to kill them. Look at New York, you know, who's that? The Tulane guy, Tom Farley or whatever. He went up there, and I think they shot him. Didn't they hang him by his toes or something about banning the soft drinks?
Waves there,
yeah, he made some waves. He came out of the environment. But I mean, and same thing we ask, should we go down that road? What do you think? I'm just going to tell you my own opinion. I think we need to ban soft drinks and chips and make people need a prescription to get them.
Yeah, I mean, there are definitely some controversial thoughts out there, and definitely people have very different viewpoints on that. Yeah, there are some people who think, let's just regulate, make the bad foods
we regulate crack cocaine
unavailable, and then there's the other side that say, well, it's my choice, I can choose what I want. I think that there's a middle ground somewhere in there where maybe we can promote the healthier items, so make it more competitive for those healthier items, instead of maybe outright banning. I think that from a policy perspective, that would be, you want to go the route where there's less pushback to actually be able to get something done. So there are definitely different philosophies on that, and lots of innovative and people pushing that line.
All right, let's go back here. Now, because we only have a minute left, what was the final conclusion of this of increasing access to healthy foods?
Yeah, so I mean, basically, to sum up, we found that there were barriers, but that there are opportunities, and that the customers of the stores that we did talk to did say that if the store were to provide fresh fruits and vegetables, that they would be, I think it was 90%, said that they would be likely to buy those items that are in there. So
put up or shut up.
But I think that there are opportunities. I think that it can be done at 2 levels. So it could be on a smaller scale level in a particular neighborhood where the residents really do want fresh fruit access, and they can work with their own stores there. Well,
Ms. O'Malley, awesome. Sylvain, health issues. Eat healthy food. Let's ban all the junk. Move forward, and we need to have longer, healthier lives. Thank you so much.